Is it true that eating sweets doesn't cause blood sugar? Hi, I'm Dr. Eric Westman, and welcome back to my channel where I review and debunk nutritional information online. In this video, we're going to talk about what affects blood sugar and what causes diabetes. Be sure to wait till the end of my video where I give you my final thoughts. This is a video from an endocrinologist in Brazil, and it's going to talk about some things that I see are pretty common confusion sources where doctors aren't giving you the entire information. A lot of it depends on the context, but let's hear what the doctor said.
If I told you diabetes isn't from sweets, would you believe it? Probably not, because that's one big lie about diabetes. In this video, I'm going to bust 9 total myths about diabetes. And what's number 1? That's the one. Diabetes doesn't come from sweets. If you eat something sugary, you won't get diabetes.
So the first lie is diabetes is caused by eating too much sugar. Well, hang on. So what he's saying is that sugar doesn't cause diabetes. Well, it wasn't so long ago when diabetes was actually called sugar diabetes. I wish it was called that again, because diabetes is a problem of elevated blood sugar. And yes, it's more specifically glucose, but I'll talk about it as sugar, blood sugar. So when you think about what raises the blood sugar, it's foods that have sugar in it. And starches get digested to sugars, so starches can raise the blood sugar as well. Now, many of my patients don't have to believe me or trust me, even though this is a basic biologic principle. They can get a continuous glucose monitor, or you can prick your finger to see what your blood glucose is and see what happens when you eat something that has sugar in it, or drink something with sugar, or eat a starch which gets digested to sugar. All of these things raise the blood sugar. So, but wait a sec. I think what he's saying is that you can eat sweets and not have diabetes. Well, okay. It's a matter of the amount. It's the matter of the context. I guess a good metaphor would be you can go out in the sun and not get sunburned. Of course, if you have too much sun exposure, you can get sunburned. And wait, it depends on the melanin in your skin, which can protect you from the sun and getting sunburn. So I guess the sun doesn't always cause sunburn. Well, okay, so what he's saying here is eating sugar doesn't always cause diabetes, but it does raise the blood sugar. Now, why is this confusing? Well, diabetes is a cause diabetes is a phenomenon of elevated blood sugar all day long. So that if you eat carbohydrates, which are the starches and sugars, which get digested to sugar and raise the blood sugar, if you eat carbs all day long, the blood sugar is elevated all day long, yes, this could give you diabetes. So the amount that you eat really matters, how much you eat. And then if you have insulin resistance, typically from overweight or obesity, that carbohydrate you eat can cause the blood sugar to stay persistently elevated. So does the sugar cause the diabetes? Well, it causes the elevated blood sugar, and in the right context, let's say you go out in the sun and you're fair-skinned like me, you'll get a sunburn if you stay too long. So the amount of sugar and the context, if you have obesity, a little bit of sugar can raise the blood sugar all day long, and absolutely, eating too much sugar can cause diabetes. But what he's saying is the opposite, which is it doesn't always cause diabetes. Is that confusing? Yeah, but if you want to not have diabetes, don't have sugar. If you can tolerate sugar, great. If you don't want to get sunburned, don't go out in the sun. But if you want to go out and play and you can be protected with sunscreen or a hat, or you have dark skin so you don't get burned as much, you can do that too. So it's fascinating how the context really matters. Also, are you an exerciser? If you exercise or you just walk all day long, remember this is someone in Brazil. The context in the US, where I see people not exercising much at all, I see people who have knee pain and hip pain, so they can't exercise. So they're not able to burn off any extra carbohydrate and sugars and starches that they eat. These will have more of a tendency toward diabetes. So I have to take issue with this. It's not a lie that eating too much sugar causes diabetes. Now, it is not true in every case, but it's not a lie.
Not type 1, type 2, not even pre-diabetes. So how does diabetes happen? Type 1 is an autoimmune disease in about 5 to 10% of cases. What's that mean? Your body attacks the insulin producing cells, the beta cells, in the pancreas, so your body can't make insulin anymore. What's insulin do? It takes blood sugar and puts it into cells, into muscles. So you get diabetes because your body can't make insulin.
So type 1, good point, that the problem with type 1 diabetes is insulin deficiency. Your body isn't making insulin, so you inject insulin. And in this case, sugar doesn't cause diabetes, doesn't cause type 1 diabetes, but it can elevate the blood sugar in type 1 diabetes. And I've seen people eating lots of carbohydrates with type 1 diabetes, where in eating sugar, where it does raise the blood sugar. So it raises the phenomenon of an elevated blood sugar, but the type 1 is caused by the absence of insulin. I get the impression here that he's trying to make it complicated. The simple answer is if you reduce and eliminate the sugars and the foods that raise the blood sugar, this becomes an entirely manageable and reversible issue. I've seen people with type 1 diabetes use very low carbohydrate diets. They need much less insulin and their blood sugar control is much better. That does sugar cause type 1 diabetes? No. But does it make it harder to manage? Yes. Now let's get to type 2 diabetes.
And with type 2, it's insulin resistant. You got insulin, sometimes too much, but it can't work. The body's resistant, so it's resisting insulin. So blood sugar levels also go up. That's why it happens. But what causes insulin resistance? Lots of stuff. The main one is obesity. That's why obesity and type 2 are so closely linked. But there's other factors too. Genetics, being lazy.
Well, hold on. So what caused the obesity? Yes, the old days you would say it's energy in, energy out, calories in, calories out, duh. But actually the carbohydrate insulin hypothesis of what causes obesity is pretty well entrenched. There was a consensus paper done by the calories in, calories out, and carbohydrate insulin theorists. I'm one of the carbohydrate insulin theorists, and I was on the paper. And basically it's acknowledged that both points of view have their merits. And so actually it's the carbohydrates and the sugar that leads to the insulin that leads to the obesity in the carbohydrate insulin theory of obesity. And then in this case, yeah, sugar did cause the obesity, and that's causing the insulin resistance. So Dr. Sorio doesn't understand that the insulin resistance was actually caused by the sugar in the first place. But he's saying that it's insulin resistance, not the sugar, that's causing the type 2 diabetes, the insulin resistance, the pre-diabetes. So actually the alternative hypothesis is not just this out of the blue you get obese and you get insulin resistance. The alternative hypothesis is you eat too many carbohydrates. Again, it's the amount that matters, and that raises your insulin level. Having insulin level high all day long makes the cells not listen to the insulin. So the insulin resistance is actually coming from outside the cells, making the cells not react to the insulin. It's not some factor inside the cell that's causing it. And you'll hear that on the other point of view of that it's excess fat in the pancreas causing insulin resistance. Well, that also gets better when you cut the carbs and the insulin down, and the fat gets burned up in the cells as well. So I get the impression here that Dr. Sorio is trying to make this complicated for you, or to just wave the hands to say, you know, yes, it's okay to have some sugar. In the right context, that's fine. In the wrong context, no, I don't agree.
Lazy, even diet can play into developing type 2 diabetes. But sweets alone won't make you diabetic. But if you're already diabetic, then yes, sweets spike your blood sugar.
Oh, okay. Well, I like that context now. That if you have obesity, well, that came out of the blue or came from carbohydrates and insulin, then having sweets will raise the blood sugar. So if you've been diagnosed with prediabetes or diabetes, which is elevated blood glucose all day long, you want to be very careful about sweets and also carbohydrates, the starches that get digested to the sugars. So I put them all together and just talk about them as carbs. But so the thing that he's not mentioning though is your blood sugar may go up and insulin may go way up to keep the blood sugar down. So you don't really have elevated blood sugar all day long called diabetes, but you have this really high insulin, which is not a good thing in the long run. Remember, that's what's going to be causing insulin resistance. So I look at it from the other way is, let's just start out without any sugar. And, if you develop diabetes, no, you're not going to develop diabetes if you have no sugar. So how much sugar can you tolerate? How many carbs can you tolerate and still not develop diabetes or elevated blood sugar all day long? Rather than what he's coming from is, we've always eaten sweets, we love them. Why do we have to give them up? We only have to give them up if we have a problem. Well, I understand that. Some people can tolerate the sugars and the starches. Like some people can go out in the sun and not get sunburned. Other people can't.
Even diet can play into developing type 2 diabetes. But sweets alone won't make you diabetic. But if you're already diabetic, then yes, sweets spike your blood sugar. That's the difference. Number 2, the second big lie surprised me. I see a lot of you comment about the pineapple diet. Is it true? False? It's a big lie. Well, the pineapple diet isn't for diabetes. First, no one can eat pineapple all day, every day. These really restrictive diets might work short term, but not for treating diabetes. So these miracle diets like the pineapple, lemon diets, teas, whatever, won't work by themselves for diabetes treatment. Don't fall for these false diabetes cure promises. Most times, they just want to trick you with sweet talk. They're just trying to sell some supplement or stuff claiming it's a cure, but it's not. Okay? As for pineapple diet, you guys can stop mentioning it now. Heard about the pineapple diet? Did you try it? Drop it in the comments. I'll like and pin pineapple diet comments number 3.
Yeah, I've never heard of the pineapple diet, but I've seen people do all sorts of crazy diets. And the idea of having something that's very high in sugar as a cleanse yeah, I agree with them on this one. That's a myth that these things can fix the diabetes. Of course, it might if you have massive amount of weight loss as a result of it, but this is not a healthy way to go about it. So yeah, be careful about these crazy fruit-based approaches unless the calories are super low and you're losing weight. Then that can lower the blood sugar and lead to weight loss, but it's just not a healthy way to do it. We're made of protein and we really need protein every day if there's something that we need every day, water and protein.
Third big lie, prediabetes is the stage before diabetes. But hold up, you thought that was it, didn't you? Because prediabetes might or might not, why, come before type 2 diabetes. So not every pre-diabetic person will develop diabetes.
Well, so I disagree. Prediabetes is the step before diabetes. Not everyone will develop it, but it's the step before. So here, just because not everyone gets diabetes, it doesn't mean prediabetes isn't the step before. Prediabetes is really just early diabetes, and you should take action. Don't necessarily take a medication, take lifestyle action, that diet that's low in calories or carbs. The one I teach, low in carbs, will reverse prediabetes. So that's a wake-up call. And I disagree with, technically he's right here that not everyone develops diabetes with prediabetes, but why take that risk? Why take a chance that you might develop type 2 diabetes?
A study followed people with prediabetes for 5 years, and 75% didn't get diabetes. That is, only 25% pre-diabetics became diabetic. So only 1 in 4 developed diabetes over 5 years. If you're pre-diabetic, don't lose heart. Many can reverse what's happening in pre-diabetes and not become diabetic. That's good news. Don't get down. Many pre-diabetics manage. I see it every day. Pre-diabetics who never develop diabetes, even getting back to normal. So that tale about being doomed to get diabetes is a big lie. It annoys me since it discourages people, hindering their progress.
Oh, well, I see. I agreeing with that, the idea of prediabetes inevitably becoming diabetes, that's not true. You can take action and reverse that progression. In fact, you can, with type 2 diabetes, reverse it and so that you don't have diabetes at all. I see that if you're hearing that you're going to have diabetes, type 2 diabetes forever, there's nothing you can do. No, this is not true. Most people with diabetes can reverse that with weight loss and cutting carbs from the diet. You can actually reverse type 2 diabetes. And I know you might be hearing it for the first time, but I see this in my office like Dr. Sorio does all the time. You can reverse prediabetes and type 2 diabetes with medical supervision if you're on medications, for sure.
You know what stress does if you're all stressed out? Cortisol and adrenaline levels rise, and so does blood sugar. So the less stress at this stage, the better. Number 4, diabetics can't eat fruits because of fructose. This is one of the craziest lies I often hear. Why? Because what harms a diabetic isn't fructose, it's too much fructose. So there are many fruits diabetics can and should eat.
Well, so hang on. Again, this depends on the context. And I'm seeing this really as the same discussion as that myth that diabetics, and I talk about people affected by diabetes because you're not always a diabetic, so it's not like an ethnic group or something, a characteristic you can't change. So if you're affected by diabetes and you eat fruit, it's going to raise your blood sugar. Now, he gets into this, he's a little confused because fructose is in fruit, but also sucrose is in fruit. And so fructose doesn't raise the blood sugar, but sucrose is half glucose and half fructose. And all you have to do is eat a banana and see what happens to your blood sugar. It'll go up because it has glucose, and glucose is technically what raises the glucose in the blood sugar. And I've seen people talk about fructose and get off on tangents, and fructose never really occurs by itself in nature. It's always with sucrose, meaning there's some glucose. So if you eat fruit, it's going to raise your blood glucose. On my program, if I'm reversing diabetes or preventing the progression of pre-diabetes to diabetes or trying to keep people healthy, and when it comes to glucose and insulin, I'm going to be very careful and say don't have any fruit at the beginning, because I don't want you to eat anything that might raise that blood glucose or sugar. And so I disagree on this one, that if you have fruit, you have to be very careful with the amount. The amount of sugar in someone's bloodstream, if it's normal, is 5 grams. 5 grams of glucose. So if you look up an apple, this has 20 grams of carbohydrates, and a fraction of that is glucose, let's say half of it. So that's going to raise your blood glucose, even an apple. And a banana is worse. So again, you can get a continuous glucose monitor, you can measure blood sugars like this, or you can just take my word for it. We've seen this, it's basic biology. So no, I don't think you should have fruit if you have diabetes until you've reversed it.
They're packed with vitamins, minerals, necessary nutrients. Full of fiber, but you should go for low glycemic fruits, and also ones with a low glycemic load. What are these terms? You should know if you're diabetic. Glycemic index is how much that food will spike your blood sugar. Higher the index, worse for the diabetic. And glycemic load is as important as the index. It's the sugar or carb content in each food.
Yeah, so low glycemic, low glycemic load, low glycemic index, those are all terms used. They're confusing to most people. I like to look at the carbohydrates, the total carbohydrates, as the way to evaluate a food or a product. It's simpler. It actually is a little more precise than using the glycemic index or glycemic load. And at the type of diet that I use that keeps the carbohydrate super low, I'm not telling people to eat glycemic index level carbs. I'm telling them to eat very, very low amount of carbs, and the total carbohydrate content, total, not net, where you deduct the fiber and the sugar alcohols. Total carbohydrate content is the most scientific, precise way to gauge the amount of carbohydrate that's going to impact your blood and your metabolism. And it just gets confusing talking about glycemic index.
Being diabetic, choose low glycemic food with little sugar, like oranges, cherries, plums, whether red or black, apples, strawberries, avocados, guava, just to mention a few. So yes, you can eat fruits, but don't gobble down kilograms of avocado. Moderate.
Well, there he gets into the amount, which is huge. Okay, so let's say you're otherwise healthy, you're young, you're active, you don't have diabetes. Sure, you can eat fruits. And are you going to develop diabetes? I don't know. Depends on your metabolism. But now you get into the clinical realm where people come to me already with prediabetes and diabetes. I have an entirely different point of view, and I tell people not to have any fruit or berries. Berries are just little fruits. And if you do, you have to be very careful to moderate the amount. A fist is roughly a cup. So this is half a cup, quarter cup. A quarter cup of fruit or berries is going to be 5 total grams. That's going to raise your blood sugar. So you have to be careful. When he says moderation is key, that is context dependent, because in many cases people come to me, they're unable to moderate. So if you're unable to moderate the fruit consumption, you can't have it. Total abstinence is easier than moderating for many of these foods if they have that tug at you and you can't control them. So that's why we eliminate all the carbs at first with somebody with diabetes, so that they don't have a pull toward any of the sugar or starches in the diet anymore.
Moderation is key. Other fruits like banana have a higher sugar content. These fruits need more attention from you. Make sense? They're not off limits, but you'll need to limit them more. Number 5, another myth. If I have no symptoms, I don't have diabetes. This I hear a lot and see online all the time. Often, with slight sugar increase, this is early stage type 2 diabetes. You won't feel any symptoms, but even a slight rise in sugar levels increases your risk of heart attack or stroke. Even if you don't show any symptoms, you could still be asymptomatic. It doesn't mean you ain't diabetic. In fact, millions of people have diabetes, and they don't even know they have the disease. Diabetes, typically you lose weight, get thirsty, pee often, wake up a lot at night to pee, feel tired, feel fatigued, get hungry. But these symptoms evidently only happen when your blood sugar levels are quite high.
I agree on this one. The asymptomatic nature of, so no symptom, you feel fine, you might have early diabetes and pre-diabetes. It can really only be discovered by some sort of blood test. The symptoms, late symptoms, are thirsty, urinating a lot, being hungry, losing weight because you're urinating glucose so much. That's kind of rare these days. Most people, they're seeing doctors and they get it picked up. The diabetes is picked up on a routine screen. Occasionally, though, you'll feel ill, you don't know why. I think it's still good to talk to a doctor periodically. They can get a heads up or a blood test every year or so to see if you're going in that direction of elevated blood sugar, which is pre-diabetes or diabetes itself.
In the early stage of type 2 diabetes, you won't show these symptoms, okay? So get routine checkups, get your fasting blood sugar checked. Just because you don't have symptoms doesn't mean everything's fine, okay? Number 6, medications speed up and worsen diabetes. Because often when you're in the early stages of type 2 diabetes, doctors start treatment. When treatment starts, many people take the meds, but don't do the important changes like lifestyle modifications, a healthier diet, starting to exercise. Then you go back for a checkup and the doctor has to increase your meds. So you think, hang on, I was on one med, now I have to take another? Because you see, you never fixed the problem, you're just treating the result. You never changed your lifestyle. And if you don't make those changes, diabetes is bound to get worse.
I like that point, that medications manage diabetes. They don't fix it. They don't reverse it. And yes, some diabetes medicines can actually make it worse. And it's well known that some of the blood sugar medicines that lower the blood sugar, think about it, where does the sugar go? It goes into the cells, and if you have extra energy, more than you're burning that day, that sugar is going to be turned to fat. Of course, that happens in the liver and the fat cells themselves, but the liver, fatty liver, is actually the creation of fat from excess carbohydrate. And then when the fat in the liver is full, it gets sent out to the fat cells for long-term storage. So, when you have a doctor say, it looks like you have prediabetes or diabetes, here's a medication, what you want to do is say, hang on, let me look around and see if there's some other lifestyle change that I can do. And when the doctor says, well, no, you have to have a medicine, just time out, look around, see how other people have reversed their diabetes. A low-carb keto diet can do that for you. And the idea that medication care is the only way to go about it, I totally agree with Dr. Sorio. Lifestyle is much more powerful than medication in this chronic illness of prediabetes and diabetes, type 2 diabetes. You can reverse it with lifestyle, and I mean just diet alone. You really don't have to exercise. But now if you put this together with Dr. Sorio is saying just eat the fruit, if you're changing the lifestyle and you want to really reverse that blood sugar elevation, don't have any fruit or berries. It's going to give you the best way to control the blood sugar. Otherwise, the doctor will say, oh, you see, the lifestyle change didn't fix it. We're just going to go up on the medication. When you get to the point where a doctor says you need insulin, this is a branch point where you pause. When someone is saying you need insulin, say, thank you for the recommendation. I'm going to go try something else. Because once you get on insulin, it's going to make you gain weight. And as you've learned, it's the weight that contributes to the insulin resistance as well, so that insulin makes you gain weight and worsens the insulin resistance. It doesn't fix it. So it really will sentence you to a life of diabetes if you go on insulin, unless someone intervenes with a medicine that makes you lose weight, or you go for weight loss surgery or some other weight loss kind of program. So be very careful with being given insulin. It's not a fix. It doesn't reverse the problem.
So it's not the meds, but it's you who didn't change lifestyle. If someone says to you, I won't treat it as it'll get worse, that's total BS, okay? Don't fall for that. It's going to harm you, got it? Obviously, you won't take meds if you don't need to. I'm not saying that. Number 7, type 2 diabetes can't be reversed. That's a lie. It's not me saying this. It's the American Diabetes Association, ADA. What are the criteria for reversing type 2 diabetes? If you stop meds and still, after 3 months, you maintain an HbA1c lower than 6.5, that's considered reversing type 2 diabetes. Can't reverse type 1. It's an autoimmune disease. And cure or remission aren't really terms we use for diabetes. Cure applies more to something like an infection, which antibiotics can clear up. Diabetes requires constant care. It's not cured, Remission, rather, implies a dormant disease. Some experts even use this, but it's really for another disease, autoimmune, like hypothyroidism, a Graves' disease. Stuff gets better with meds. Treatment puts it into remission. It's there, but dormant. Diabetes is different. You reverse insulin resistance. So reversal fits better for those who control and roll back type 2 diabetes. Point 8. Overdose.
So I like that it was a little worry about the terminology, but you absolutely can reverse type 2 diabetes. And saying cure kind of puts out the feelers for the regulators, and better to say reversal of the diabetes, prediabetes, absolutely. And I agree with this one. It's a myth that you have to have diabetes forever. And you just need to find a doctor who's willing to think about this in a different way, who doesn't always go for the prescription path.
Dosing fiber-ridden foods for diabetics. Why is that not true? Clashes with all you heard. Surprised? Well, let me explain. Check for sugar, carbs, calories along with fiber in food. Fibers alone don't make food healthy. Take oats. Seems healthy for diabetics, right? Oats have fiber, sounds healthy, but diabetics need special attention. Why? Up to 65% of oats is sugar. Carbs, did you know? Probably not. Check out oatmeal's nutritional info, you'll see. Is it fiber rich? Yes, but it also has high sugar and carbs. In the short run, it won't spike your blood sugar much compared to other sugary foods because it has fibers. But in the long run, you're overeating calories. You'll intake excess carbs and sugars. I had mentioned in a video how much I love oatmeal, I eat oatmeal a couple times a week, but I don't have diabetes. So remember when I said it's healthy? But diabetics need to be extra careful. Just because I eat it doesn't mean everyone should. It's not that simple. Check your own situation.
Well, so fiber is a funny thing, and this is getting a little complicated. You know, I try to find things that make life simple. And instead of talking about this food and which one is good and bad, and just look at the label and look at total carbohydrate. The number that comes after total carbohydrate is the grams. G means grams. And that total carbohydrate grams will guide you as to the effect of that food on your blood sugar. Yes, the serving size will matter, but if you're on the kind of program that I teach, you're going to be choosing things that have 0 total grams or 1 total gram or 2 total gram, and the serving size have to be really large to have a big impact on your blood sugar. So I prefer not to talk about, you know, the oatmeal or this or that, what type of fruit and all this. Just look at the total carbohydrates, and if the food comes without a label, that's really good. I prefer those foods. Look it up on your apps or Google or you know, your browser. You can just type in nutrition facts banana, and it's going to tell you how many grams of carbohydrates are in a banana. So it's not difficult to find this information. And total carbohydrate, I think, is a better protection against foods that are high rather than, you know, oatmeal. What about steel cut oatmeal? What about the, you know, whole grain bread? No, just look at the label, and you don't have to worry about the type of food.
Number 9, only the obese develop diabetes. Why is that a lie? We found that 11% of diabetics aren't obese. Other factors like genetics come into play. Some folks have genetics that favor insulin resistance. Even without obesity, they're likelier to develop diabetes. Not to mention type 1 diabetes, which isn't weight related. It's an autoimmune disease, as I mentioned earlier.
Yeah, so it's interesting. So some YouTubers will take the, you know, 90% of people who have diabetes, type 2 diabetes, are obese, and talk about how it's so commonly related. He took the other angle, which is, well, 10% of people with type 2 diabetes are not obese. So, which, okay, that means most people are obese, but the idea is, I think the teaching point is, you don't have to have excess weight to have the problem of diabetes. I've seen people who are drinking sugar, and in a world that most doctors don't understand the effect of food on the blood sugar, in one day, this person stopped drinking sugar. I think it was a sugary soda, you know, a liter or 2 per day, and he was able to come off all of his insulin in one day. This is the phenomenon of basically the insulin was treating the carbohydrate in the food and the drink. I wish every doctor would ask you, are you having any sugar in the drinks? That's kind of the low bar, the minimal level of control. Don't drink sugar, please. I mean, why take that when there are sugar-free things? There are all sorts of things, the flavored waters that don't have carbs that raise the blood sugar. And at the end of the day, the amount of carbohydrate you eat matters. Sure, you could have a piece of candy and a sweet, and it doesn't cause diabetes, but if you're eating carbohydrates all day long, starches get digested to sugar, and sugar raises the blood sugar, it causes the obesity, causes the insulin resistance. This is the story that we tell that hangs pretty tightly, because when you cut the carbohydrates away, it all goes back down this pathway. You start fixing the blood sugars, you lose the weight, the insulin resistance goes away, and there's no diabetes. So I guess to wrap up here, you want to be careful about sweets and starches and carbohydrates. Total carbohydrate is a great way to gauge the amount that's in a certain food and the serving size. But the final point I want to make is that in a world without sugar and starch, there is no diabetes. So let's just think about that. in a world without carbohydrates, there is no diabetes. And I'd like to be proven wrong if you can find that situation. Animals that are carnivores, that don't eat carbohydrates at all, don't get diabetes. So humans as well won't get diabetes if you don't eat carbohydrates. So if you want to try to get away with how many carbs can I have and enjoy them and not get diabetes, you can play that game and you can monitor the blood sugar and the insulin. Or if you want to keep it simple, just minimize the carbs, because that's what raises the blood glucose. And then we've been kind of sort of doing some mental calisthenics here around causality. Certainly, if you cut carbs out and you lose weight, you can reverse the diabetes. I have a tool, much like a ladder, to go up and take a kitty out of the tree. So imagine, so I'm a fireman, I have a ladder, I take the kitty out, I can reverse diabetes with what I do. Does that prove that taking away the carbs caused it, or the ladder, the kitty went up the ladder on the tree? No. But it's an effective tool to fix it. So I don't really care how the kitty got up onto the tree. I can take it down with a ladder. I don't really care what the cause of the diabetes is. I can reverse it by using a keto diet. And if you're on medication, be sure to get medical monitoring. Well, if you enjoyed this video, be sure to like, subscribe, and ring the notification bell so you don't miss out on any further content. New content, new videos are put out now on Wednesdays and Fridays. If you enjoyed this video, be sure to like, subscribe, and hit the notification bell, and check out adaptyourlifeacademy.com.